All right. Good morning and welcome to day 2 of the Iowa Ideas Conference. You have joined the Kids in Foster Care session, a part of the Human and Social Services track. I'm Amy McKelvey, your room host. Hope you were able to catch some of the sessions yesterday. If not, they were all recorded and will be available soon on the Iowa Ideas website. Wow, I need coffee. This is the first of 2 session blocks today, followed by a keynote presentation from David Kennedy at 11 o'clock. And the day will close with a big idea virtual social session from noon to 1 that will be split into 4 subgroups, including Iowa Big, Inclusive ICR, Trees Forever, and Youthport. So we invite you to pick a room, learn about initiatives happening within the various groups and how you can get involved. Please feel free to submit questions during this session using the chat panel in Whova to the right of the screen. As a reminder, questions and comments should be related to the session topic and remain respectful. Please remain muted during the session and use hashtag Iowa Ideas 2020 to share your big takeaways and what is moving you throughout the conference. These pieces and our coverage of the conference will be part of the Gazette's Iowa Ideas content throughout the year. And now I'm happy to introduce Alison Gowans, who will be the moderator for this session.
Hello. Thank you, Amy, and thank you to all of our panelists for joining us today to share their perspectives. And thank you also to our audience members. We are happy you're here and hope that you can come away with some good Iowa ideas, as the conference is called. We are talking about foster care in Iowa today, and I just want to start by asking our panelists to introduce themselves and tell us a little bit about the work that they do. Anyone can start.
Great. I can go ahead and get started. My name is Janee Harvey. I'm the Division Administrator over Adult, Children, and Family Services at DHS. Within my division is 4 bureaus, one of those bureaus being the Bureau of Child Welfare Services.
Mm-hmm. I can go. I'm Kai McGee with Four Oaks, and I work with our program that recruits, retains, trains, and supports foster and adoptive parents in 4 of the 5 service areas in Iowa.
Mm-hmm. And hello, I'm Dawn Luetje. I'm happy to be with you guys this morning. I am the Director of Resource Family Licensing and Support over at Lutheran Services in Iowa. We cover the 30 counties on the western side of the state, so the other service area not covered by Four Oaks, for the recruitment, retention, training, and support contract with Resource Families in foster care and adoption.
Okay. Well, I just want to start out by asking you guys how your work has been impacted by the COVID-19 pandemic.
Dawn, do you want?
Yeah. Go ahead, Kai.
I think for us working directly with foster and adoptive families, our work has been impacted by needing to quickly find ways to continue to meet the needs of foster and adoptive families, even during the midst of the pandemic. For some of us, that meant picking up technology we hadn't used before and trying new venues to do everything we can to continue to provide the same services that are still essential regardless of kind of the COVID conditions. And I'm proud of the success that we've had so far, but clearly we are not out of the woods yet.
Mm-hmm. Yeah, I just want to add too for what we saw with with foster and adoptive parents. It started that, if everybody remembers that March 13th day, it will be like the worst day of my life forever, because we quickly were notified to come up with contingency plans and needs to meet the resource families. Just in case daycare is closed and schools closed, and how to keep kids connected with their birth families, and knowing that children were going to really experience some loss and anxiety if they weren't able to see their birth family. So just coming up with some really good plans and ideas to help maintain those connections. And like Kai said, it was really a challenging time, but everybody did a really, really good job implementing technology and going above and beyond. I mean, maybe they used to have a visitation for 3 hours a week, and they started having daily contact, which is really the idea that we want to promote anyway. So in the long run, it probably was a better outcome.
So what were some of those solutions that you came up with to some of the challenges?
What we did was had our support caseworkers who are assigned to the foster families really working with resource families, make sure they had technology that worked. And when they closed down, and it was for probably 5-6 weeks that they weren't able to do face-to-face visitations with biological families, maybe not even that long. But during that time, they started using technology. FaceTime, I think, was one of the more popular methods of just connecting kids with their parents. And doing that through the day, they'd play games. They would come up with, someone had ideas of doing scavenger hunts. They would draw. They did outdoor walks. I mean, followed kids around with their cameras. It was just things that typically you wouldn't be doing.
I would like to answer the question, Alison. And the place that I would want to start is just by acknowledging the essential nature of the work of the people like whom Dawn mentioned, the staff who are going into families' homes, the staff who are driving kids in order to visit their biological parents. Those in-home workers are really on the front lines, even as scary as this pandemic has been, and really required people to reduce interactions with people. There are some people in our state who we couldn't ask that of because it really are life and death type situations. So this includes our DHS social workers, our family-centered service staff who are doing the work, the staff who go out and support our foster parents, are critical and essential parts of our workforce that really ensure the safety of families. So that's the first place I'd want to start. The other places where we've seen tremendous impact of COVID is at our central intake abuse hotline. We saw a really significant decrease in the number of calls compared to previous years, what we would expect to hear and to learn about families. So that really stood out for us at the department. We have since seen those volume of calls level back to more normative time, so that's helpful. But there was no reason for us at the department to assume that families were doing better in the midst of a pandemic when you're seeing social isolation, when you're seeing increased economic stress, all of the markers by which you'd go, families are probably not doing so great right now. Parent stress is up, and yet the department is not hearing about those families in a way that our social workers can go out and give them support and connect them to services. So again, we are relieved to see those numbers kind of leveling back off because the families that we're most concerned about, we need to know about them, otherwise we can't do anything. The other thing I would point to, as Dawn and Kai mentioned, really stepping up the electronic mechanisms by which people can connect. The department used a significant portion of our CARES funding from the federal government in order to provide technology grants to our contractors in the state. So those parents who are really missing their kids who might be in foster care, that money has been used to purchase iPads, cell phones, things that will allow at least virtual connection in a time when maybe being in person was not as safe.
Were the drop in calls that you got, what do you think led to that drop?
Yeah, it's pretty easy to predict what caused that drop. Is that over 30% of our calls to our centralized intake come from our school personnel. So teachers, guidance counselors, anybody who works in a school building. When the schools shut down, we could immediately see that source of reports just go away. I mean, it just ghosted, right? And we see a typical drop over the summer months when school's not in session, drop down, and that's the level that we were seeing. So it's really clear to see that the missing component was the people who interact with kids in those in-person school settings. So we have seen those numbers come back up, But as we know, there are a number of school districts, Des Moines included, that are still in virtual settings. We have seen some calls from schools, even in virtual settings, but still not quite at the level as what we would expect.
Mm-hmm. Can you talk about sort of how the stress of the pandemic more generally might be impacting families and kids?
Yeah, I mean, we have a lot of child welfare-based research prior to the pandemic that is really clear. There's a very high correlation between economic stressors and child abuse and neglect. So that's an example of kind of a social indicator that can give us hints about what's going on. We know that this pandemic has been absolutely economically devastating for many people who probably already lived kind of in shaky economic situations. A parent who's under extreme stress, no parent that I've ever met, involved with child welfare or not, who's under enormous stress is having their best parenting day. Like that's pretty easy to predict. That combined with social isolation, which is also highly correlated with unstable family situations. And we also know that many of our parents who maybe struggle with mental health or substance addiction, some of those services have also been disrupted. So by every way that we would try and determine or anticipate how are our families doing, we would go, this is not a good forecast. This is not a rosy picture here. So we are really eager as things start to get a little bit more normal, that we can connect with those families and really proactively get them the supports and services they need. The last thing I would mention is, Dawn already indicated this, but there was a brief period of time where we had to shut down, for the most part, visits between parents and their kids. We know that kids who are in residential settings who suddenly couldn't see their parents or other loved ones who wanted to visit them, that had a very negative effect on them. We were hearing from our residential providers, rates of running away were up. We could see that some of the behaviors and the emotional well-being was really decompensating, because humans are social creatures. We want to see and connect with the people who love and care about us, even when we can't maybe always live with them. So we could see that showing up in behavior that was showing this emotional distressors amongst the youth and children that we serve.
Mm-hmm. I would imagine also digital connection can be great, but it's not the same as an in-person visit. You know, the same as we're seeing with like visiting to seniors in senior living care.
And maybe Dawn or Kai want to talk more about that. There's also the age of the child involved in those visits would matter a lot. So I guess I would invite them to think about, how do you manage a visit with a 6-month-old and a parent?
Right. Yeah, and during that time, we did have situations where you have high-risk kids too, you know, so it made things a little bit tough. But those little kids, we had babies who you have to have that attachment and you have to have that connection. In one area, we did have a foster parent reach out and said, this just isn't right. Pandemic or not, this child needs to be with having that connection with that parent. So, you know, they did go ahead and continue to have that face-to-face visit. But in some situations that couldn't happen. And when that couldn't happen, they needed to have almost continually teaching by phone and video, and that isn't real, you know. So I feel like most situations they did a pretty good job with those real young kids and trying to get them back in connection.
Mm-hmm. Are in-person visits happening again now, or is it still mostly digital?
Yeah, DHS was great. We opened things back already in June, and right away, as soon as possible, they were back having face-to-face visitations. So that was good. And of course, they had, guidelines of calling ahead, doing screenings with the families and with the children, the birth families, foster families, and the children to make sure that no one was sick and not having symptoms. Masks were to be worn with the older kids and with the older adults and people involved in the visits. And then we also did if visits were supervised, they did a lot of discussions in regards to social distancing and some of those type of things. Now, first thing kids are going to do is run up and hug their parents, So trying to just maintain safety within those environments and still allow for those connections.
Sure. Mm-hmm. I do want to talk about the two ombudsman's reports that came out this year, looking at the deaths of Natalie Finn and Sabrina Ray. Are there lessons being taken from those two tragedies, and what can be done to try and prevent situations like those in the future?
Yeah, so at DHS, our leadership has worked through both ombudsman's reports, and we think that many of the recommendations are really valuable, and we are in the process of working through each of those recommendations and determining what that will look like at DHS. Some of those recommendations that stand out for me, and I am specifically involved in, is internally having a fatality review team. So we're working right now on looking at which cases would trigger a full kind of in-depth review, who would be involved in those reviews, how do we make sure that we're paying attention to strengthening practice, policies, if there's contracted servicing gaps. We want to make sure that we're doing really a fulsome review on each of those situations to see if there are lessons learned. I would also balance that by saying there is no state, no district, no jurisdiction that has zero child abuse fatalities. There is none in our country. I mean, if there was, we would be buddying up with them and going, how did you do this? I mean, it's terribly sad. It breaks our heart. I know every child welfare professional I've ever worked with leads with their heart. We take this work home with us. It's devastating and tragic. And I also in the same breath have to acknowledge child abuse fatalities will happen again in Iowa, just like every state. So it is really our job to figure out how do we reduce those? What does that look like? Unfortunately, we have, in terms of child abuse related fatalities, we know in Iowa that sleep related deaths involving small children, especially under the age of 6 months, we think there's an uptick of that. We need to wait and see until the end of the year when we have the total count. That might also be some pandemic related, but if we know that sleep related situations are resulting in a high number of deaths in our state, we need to take that really seriously and look at collaborations such as a collaboration between DHS and IDPH, where we can engage in safe sleep campaigns and things of that nature. Again, there are a number of recommendations out of the Ombudsman report. Some of those I know immediately we're working on. Some we are considering what pieces of the recommendation make sense. Some maybe don't make as much sense, but we are going to be very transparent in our efforts. I know Director Garcia is working on putting together a tracker that would be publicly informing people who are interested on where we're at in our implementation process as we work to do better.
Mm-hmm. Are there things that could be in place to help you better, better carry out those goals? You know, are there concerns about funding, staffing, things like that could help with those recommendations?
So we are in the process of hiring a number of staff at DHS. I would say that Governor Reynolds has been really overtly and explicitly supportive of our efforts to increase our workforce. In our recent history, so not far back at all, Iowa was tied with Indiana for the highest level of caseloads amongst DHS social workers. That is not where you want to be. Every family requires time and attention if you're doing the work right. And when you have staggeringly high caseloads, you know that the corners might be cut at points, or things might be missed, that if you had less families, you're just going to take in more. So I would say that we are really optimistic at DHS that we're headed in the right direction in that regard. One of the other big things that we're working on is some of the breakdowns in communication, or places where we maybe had information, but the right person didn't always have that information. That speaks to an IT problem. We have a very, very archaic child welfare information system. I'm talking 1980s. If some of you saw it, you would be really, really shocked at the mainframe system that we have to use. It is ridiculously challenging, and it's unnecessary. So one of the things that we have, again, support from Governor Reynolds and a lot of enthusiasm from Director Garcia, is we are just now getting started on formally on our process to developing a comprehensive child welfare information system. It will allow our child care licensing workers to communicate in real time with our social workers. So if our child care staff are aware of something, it can immediately go to our DHS social workers. We're working on increasing and enhancing the IT supports between our contractors. So if one of Dawn or Kai's staff are aware of something going on in a foster home, that can immediately go to the social worker. Some of this is pretty basic IT functionality in 2020, but it will be novel and really exciting for our DHS social workers to have that information.
Wonderful. As a reporter, I might have to follow up with you on that and learn a little more. Oh,
I'd be happy to do that. Great.
Okay. For our audience members, the four of us had a little chat a few days ago to just talk about some things we might want to bring up, and you mentioned the Family First Prevention Services Act. I wonder if you guys can talk a little bit about what that will entail for Iowa and what changes it's going to bring.
Because I've spoken so much, I'm wondering if Dawn or Kai wants to start that answer.
Yeah, I'd be happy to. I think all of the points that have been brought up today register with me, and hopefully with the audience, the need for all of us as community members, as citizens, to be aware that there are very vulnerable people and children among us. They're living in our communities, and we all have a role to play in serving them. And recognizing that vulnerability as early as possible and getting services in place as early as possible where that's required. And I think that's what the Family First Prevention Act really looks at, is identifying as early as possible families that may be struggling or kind of on the verge, and stepping in with the right amount of services, the right type of services at the right time and at the right intensity to make sure that those families don't cross over into real crisis. And when they do, and when the intensive services need to pick up a little bit, I think all of us are really passionate about making sure those services are taking place within that child's home community, within their own neighborhood, within their own school system, and that a child leaving a home to go to foster care or relative care is really absolutely the last ditch thing that, the last ditch intervention to make sure that we can ensure safety. And when we have to go to that extent, I think we all want to see that be. We want that child to go to a family member or somebody that they already know and are deeply connected to. And we want them to have to be in that out-of-home environment for the shortest amount of time possible required to make sure that they can stay safe. So all of the legislation and changes that are happening at a public level, at a private level, I think are really geared towards, again, as I said, engaging earlier. In our work with foster and adoptive parents, we can't neglect or exclude our relative or kinship caregivers who are sometimes grandparents who are in retirement, maybe living on a fixed income, and all of a sudden are faced with caring for 4 grandchildren that they never anticipated caring for. And so what can we do as contractors to step in and support those grandparents and make sure that they understand what those children's needs are going to be, and do everything we can to provide supports for them during the time that those children are living, with their grandparents or aunties or uncles or school teachers and daycare providers who step into the gap. And again, my invitation is always back to the communities and community members and audience members that, those families, the relative caregivers, foster adoptive parents, they need community supports. They need people coming around and wrapping around them with services and support and volunteering and dropping off dinner and helping take kids to appointments if that's what's needed. So kind of an all hands on deck, but that's my impression, I think, of the families first.
Yeah, I want to build off of that really nice introduction that Kai did. The Family First Prevention Services Act was passed into law in February 2018 at the federal level. So every state since the beginning of 2018 has been working on their Family First implementation plan. And in Iowa, we just went live with ours October 1st. So we are just two small weeks into 2.5 years of planning. Kind of quite simply, what the Family First Prevention Services Act says is children do best with families. I think we all know that to be true. I can't see people's faces on this call today, but usually when I say that, lots of people nod their head because we know that to be true of our own kids, that children need our families, right? And unfortunately, child welfare has a really long and very sad and traumatizing history of using foster care as a common intervention. So you might have a parent who's struggling, maybe not doing a great job, and a common reaction was take that child from their parents, take care of them physically, move them away from the parent. It did nothing to consider the social needs, emotional needs, or psychological needs of kids who might be going through a removal episode. So Family First says, you know what? There are safe ways to keep kids protected by their parents instead of keeping kids protected from their parents. There's evidence-based programming out there that has been demonstrated to keep kids safe and improve parenting skill. If states are willing to invest in those evidence-based approaches, the federal government's going to help cover 50% of the cost of those implementations. So that's what we've been working on. A really great example of this is New York City in the early 90s. That's a city of 8 million people. They had 53,000 kids in foster care. They had removed so many kids from so many parents, they didn't know where to put them. They were moving kids out of New York City, moving them upstate, really far from their family. And ultimately what happened is they created a lot of system-generated orphans. They had a ton of kids aging out with no family. And we know kids who age out of foster care have a disproportionately high rate of homelessness, mental illness, substance addiction, emergency room use, unplanned pregnancies. It's kind of every social area where you'd go, well, how did foster care work out? You'd go, this is really bad for kids. So New York City has been on this journey much longer than Iowa. They invested in these evidence-based programs. And today, New York City has 8.5 million people, and they have less than 8,000 kids in foster care. So from 53,000 down to less than 8,000, and they have not done it by having increased child fatalities. They've done it by investing in the services that families need in order to take care of their own. So that's what we're on in Iowa. That's the journey we are on. For about 5 years ago, we had over around 9 kids per 1,000 entering foster care, where the national average was 6.3. That meant that Iowa was removing a substantially more number of kids than your average state in our country. I do not think Iowan parents are way worse or worse at all than the national average. I just refuse to believe that. We have seen in the past year and a half, 10% foster care population reduction. So we are in the process of reducing our kids in foster care. We're doing that by investing in evidence-based programming. We know those programs work when they're done with fidelity, and we're seeing less reliance in our group care population. We've almost reduced by 50% the number of kids in group care over the past 4 years, because again, children need families. If you're being raised in a group home, that is not a family. That is almost certainly going to get you some bad outcomes for that kid as they transition into adulthood.
What are some of the services, the wraparound services that you guys are bringing to help those families to prevent having to have children removed from them?
Yeah, those services are on the front end. So what Dawn and Kai do is they are really involved in recruiting those foster parents. So when a child is removed and we cannot find a relative or fictive kin who is willing or able to take in those kids, they do the really important work of helping license those foster parents. So what we're doing in terms of our Family First implementation is heavily resourcing on the front end. So trying to prevent foster care to begin with. And we're doing that with our family-centered service contracts. So Kai is with Four Oaks and Dawn is with LSI. They also have contracts for our family-centered service, and our family-centered service providers. That includes places like Boys Town, Families First, Children and Families of Iowa, so some really big agencies in our state. And their approaches to doing the work look like the following. One, we have family preservation services. Those are really in place for families whose kids are most at imminent risk of going to foster care. Family preservation means that worker is out in the home virtually every day for significant periods of time, and they go, what does this family need to ensure safety? Mom, Dad, what do you need? Do you need a ride to the food pantry? Mom, do you need domestic violence services? Do you need temporary housing? What do we need to keep this child safely in this family unit? So that's our most intense service, and that can be put into place for up to 30 days. But then we also have our two evidence-based interventions, our solution-based casework and Safe Care. Safe Care is a behavior-based training model to teach parents with kids under the age of 6 how to keep their home environment safe, how to make appropriate health decisions for their child, and how to use positive parenting to impact children's behavior. A small example of that would be, I can enter into a full-on temper tantrum by forcing my child to eat carrots at dinner. But a better parenting strategy would be around giving my kids choices that I can live with. I want my kid to eat a vegetable. Does it have to be carrots? Maybe I can give them carrots, corn, or peas. We know kids who have the option of choice are better behaved because they're exerting their own independence. So that's an example of a parenting strategy that is taught to parents who have histories of abuse and neglect. Sometimes it's a temper tantrum where the parent just gets so frustrated they strike their child. Well, avoiding those high conflict situations is a really smart strategy that reduces repeat maltreatment. That's just an example.
Mm-hmm. As I've been doing these sessions and sitting through these sessions, it's striking to me how the theme that keeps coming up is all these different challenges are connected. We had a food insecurity session yesterday, and we talked about how food insecurity leads to challenges in every other part of people's lives and vice versa. And that seems like maybe sort of the same idea you're talking about here as well.
Yeah. Yeah, a child who's hungry is not typically a well-behaved child. A parent who's hungry doesn't have a lot of stress tolerance. I mean, it's absolutely, all humans basically need the same things, right? So it's easy to anticipate that food insecurity, housing insecurity, all of these types of challenges do not produce better outcomes for kids and families.
Absolutely. I would like to encourage the audience, if you have any questions, you can submit them through Whova. We haven't had any questions come through, so now's your chance. Kai and Dawn, I wonder if you can talk a little bit about foster parents in Iowa. And, you know, we hear often about foster parent shortages. Is that a concern here in the state?
Yeah,
Go ahead.
I would say, you know, my goal is that in the extreme circumstance that a child needs a foster home, I want us to have a foster home available right at the moment the child needs one, preferably in that child's same neighborhood if possible, but certainly within that same school district. And I don't know that I necessarily worry so much about shortages as I do understanding that there's more nuance to it than that, right? Some foster parents are going to be really great with kids under the age of 5. Some foster parents are going to be really great with teenagers, but not do so well with kids under the age of 5. So even in areas where if you just did a comparison looking at the number of kids who needed a home and the number of homes, it might look like you're doing okay, but that does neglect the fact that not every family is able to care for every child. So we want to make sure that we have a surplus of foster families, that we can find exactly the right home for the right child at the right moment in time. And that's probably where a lot of attention and energy is focused, is making sure that people understand that it will continue to be a need for foster homes throughout, as advanced as our child welfare system can become as we go along this family's first road, that won't negate the need for foster parents to some extent. So I think for myself and Dawn, the challenge is to make sure that we're still letting the community know that that is a need, and encouraging people to get involved and consider becoming foster parents if that is an option for them at that point in time. And Dawn, I know your agency, there are, I wouldn't say there are differences in rural and urban centers, but there are differences or challenges in regards to the number of families available, the number of daycares available. So I know that we tackle a lot. Dawn, did you want to talk about that a little bit?
Yeah, like I was saying, we still need foster families, just because not all foster families are going to be the right fit for every child. I think we have about 2,675 foster families in Iowa right now, or resource families in Iowa, but about 400 of those only take adoptive placements. So they aren't considered resources for foster children or to work with birth families. They are the end road of our resource families. They're the last resort if a family has termination of parental rights. And those adoptive families are usually needed for the older kids, the kids who are over 10, who can't get back together and may be sitting in shelters and residential treatment. Then we have respite providers. So some of our foster families are only licensed to provide respite care. So those aren't counted in the total numbers. And then we have, thank God, we have the relatives who are becoming licensed, and they are licensed only for relative care. So there's about 800 of our licensed families in Iowa who are only providing relative care. So when we get down to it, then that leaves about 1,100 families available to take placements in the entire state of Iowa. And that's not very many when you think of even short time emergency situations for a family, or when DHS does have to remove a child and they're looking for relatives and can't find a relative. We don't want those kids going into a shelter. We want them going into a family setting. So that's when we need foster families who can take kids, work with birth families, and prevent kids from going into the shelter in the first place. We know that when kids are placed in shelters, there's a lot of dynamics that create additional behaviors. You've got the trauma they've experienced in the past, and then you have putting kids into a situation that they are not comfortable with, out of their community, away from all of their connections. You know, it's really scary for a child and for us adults to think about it if that were our kid. So we want to keep them in their communities, and even if it's for a brief time that we need foster care, and that's hopefully what we're looking at down the road, is that foster care will be very, very temporary, but still a resource to build those connections with birth families, so that they might be a mentor to the birth family. They might be the person who is, maybe the birth family didn't have a strong role model when they were growing up. So the foster family can serve as that. So families who can help resource or birth families meet the needs of their family is what we're looking for right now too in our recruitment.
Are there efforts or hopes to recruit a more diverse range of foster parents, foster families? Is that an issue in Iowa?
Yeah, definitely.
Recruiting foster families of color, recruiting LGBTQ families, etc.
Right. Yeah, we are constantly trying to have efforts to do minority recruitment. We're working with families to find families who can take the sibling groups and keep those sibling groups of 4 kids, 3-4 kids together, rather than having to separate them. And the older children, finding foster homes who can care for teens, and the LGBTQ community. Our foster children, unfortunately, there is a predispositional or predominantly disproportionate rate of kids who end up needing foster care who have those identity issues that it's not appropriate for those kids to have to go into a facility just because they're not just because they have those identity issues. So
I think that to what Dawn was saying, we know that there's an overrepresentation of LGBTQ kids in foster care, both nationally and very likely in Iowa, because of the rates of family rejection that sometimes come with some of those identities. We also know that Iowa, just like every single state, has racial overrepresentation within our foster care system. Our Native American children, although in the general population is around 0.4% in our general population, make up over 2% of our foster care population. So we have significant overrepresentation of Native American children in foster care, and we have also double the average number of African American or Black children in foster care as well. So when we cannot, so again, I want to go back to that point that Dawn was making. All kids have families. We know we do. We are all birthed into families. We all have these big ancestry trees, but locating those relatives or fictive kin sometimes also takes time. And during that time, kids have real bodies and real physical needs. They need to go somewhere. So trying to prevent them having to go spend 2 or 3 nights in a shelter, that is not harmless. That is really scary for kids. A child who's just lost their parents, removed from their home, lost all their physical belongings. We are putting those kids under enormous stress because we've had to take them from unsafe living situations. When we're able to bypass those residential placements and maybe temporarily have them in a foster home where they're loved and secured while we really work on locating those relatives and fictive kin, that's the best that we can do sometimes in those situations. And that means, foster parents who are willing to open up their homes, and that's enormously valuable. And the call for anybody who thinks they have it in their heart or they have the resources to open their home to sibling sets, older teens. Most of our kids are not, 2 years old, 1 child. no challenging behavior, here will you take care of this child. That's just not the most typical situation that we are dealing with. So when we're doing a call to action for potential foster parents, being really clear what it is we're looking for, and also foster parents who are willing to mentor and coach and really be a resource for those birth parents who might be struggling. That's really hard and really important work. And that's what makes Iowa great. People who are willing to do this work.
Mm-hmm.
I think, in speaking to issues around keeping kids connected to culture and heritage, I think I heard recently that Des Moines Public Schools has well over 150 different languages spoken within the school system. To me, that says that we need foster parents who have a huge array or a diverse array of language skills. Thinking about the trauma of a child being removed from their home and maybe having to go into foster care, that trauma is 1,000 times worse if we don't have a home that can meet that child's language needs just on a basic communication level. So I think I have a real passion for making sure that when kids do have to go into care, that they're going into homes that recognize their cultural needs, homes that match them in a racial way, an ethnic way, in terms of a cultural heritage, and doing the best they can to keep that incredibly important, vital part of that child intact and respected and not overlooked. So the urgent need for a wide representation of foster parents, from LGBTQ to people with language skills, and including American Sign Language skilled parents who have backgrounds in education. A lot of kids that come into care have significant educational or academic challenges. So there's a lot of folks out there that I think have these skill sets that aren't aware necessarily that they have these skill sets that would be so valuable to kids and to their families. So I just, again, everything that Janee and Don said, the open invitation to, if you have the time and the heart to serve in a meaningful way, this is the time is now. We encourage you to get involved.
Absolutely. We have a question from the audience. Does Iowa have a lot of children aging out of the system? And how can people help support those children?
Well, that's a really great question. Those are some of our most vulnerable population in Iowa, truly our youth who are aging out of foster care. That means that they have histories of trauma, neglect, abuse, and not always, but in many situations are really estranged from any type of family connection. And when I say family, I define family as, where would you be spending your next holiday dinner? If you can't tell me that, we have not resourced them with family, right? Those are kids who are kind of unharbored is how I think of them. They're not tethered to other people. Iowa does pretty well. We do not have extremely high rates of kids aging out of foster care without those family connections, but even one is too many, right? So every life matters, every youth, age 18, transitioning to that young adulthood. I'm sure that we could all think back to the various adults in our life who helped us make it through safely through that journey from 18 to early 20s. We do have some really, a group that I would bring to people's attention is our AMP group. And those are our older youth who are in foster care, who are aging out of foster care. They are both an advocacy group, but they're also a social support group. I feel pretty confident if there are people who are interested in getting involved with AMP. They do have an online presence. They have a contract with DHS, so we also do some oversight of the work they do. I would encourage you to reach out to them and their leadership to say, hey, I want to get involved. I know that every summer they have a camp for some of those youth where they get to go and be with other youth who are going through similar life experiences that maybe they can't really share with their schoolmates because they don't know how to talk about it. They might be embarrassed. They might, it might not be a way that they relate to their peers, but when they go to this camp, they're all kind of going through similar situation, and that's really important. So that AMP group really stands out to me as an obvious idea if people want to reach out and get connected.
Mm-hmm. Another question we had come from the audience is, of the kids aging out of foster care, how many are able to go to college and how many can go full time?
So we do have college support programs. So Iowa College Aid, youth who have lived foster care experience, there's certain age requirements that I don't have immediately in front of me, but we do have a very robust financial aid program that does support youth with lived foster care experience who do want to go to higher education. So we do have that program in place, and we also have an aftercare program that is statewide. So that aftercare program is optional for youth, so it's not a requirement for them, but it is a service that's in place where they have an assigned case manager who meets with those youth after they leave foster care. That case manager will meet with them, help them plan for their life goals, education, vocational, help them set up bank accounts, get those driver's license, do things of that nature. And we also have a financial monthly stipend program that is in place for, again, youth who have certain eligibility. We do have that monthly financial support program to help them meet some of their basic needs as they transition into adulthood.
Mm-hmm. We just have about 10 minutes left. I guess before we wrap up, I would like to ask, you talked about the need to support families before it gets to the point where a child would need to be removed, support families that are at risk of that. What are things we as community members can do to help with that goal?
So we have what we call primary prevention efforts. When you hear the word primary prevention, what that means is supporting families at risk of abuse and neglect, but no abuse and neglect has happened. Because once abuse and neglect has happened, that's called secondary interventions, right? So something has already happened. It is the role of every single person in Iowa to be involved in primary prevention. Every family has bad days. If you know parents, you might even think of a parent right now that you go, I sometimes worry about their parenting, or that's a family that could really use some help right now. Really, I cannot overstate how valuable it is to send thoughtful, kind text messages, check on those neighborhood kids who you see outside. Maybe you think they've been outside a little too long without food, bringing out snacks, really embodying a caring community. That is really what makes Iowan families strong, is caring about and reaching out to one another. Even in a pandemic, there are safe ways to reach out to people. I would draw people's attention who are in the Des Moines area that there's a really great article in the Des Moines Register today about a group called Genesis Services that has set up a whole infrastructure of volunteers to help provide school support to kids with refugee status. They're looking for volunteers. These are kids whose maybe parents can't stay home with them and work virtually to help them get through virtual school. These kids need some place to go, and they need people who are patient to ensure that the most vulnerable are not falling behind in school. So again, that's an example of a call to action where people can get involved that really supports the well-being of all Iowan families.
Don or Kai, do you want to add anything to that?
Yeah, I would say, I think anything in the local community that, in particular, making contact with or trying to help school-age kids, especially those kids who have parents who are essential workers, who aren't necessarily able to stay home and work from home. I think as we go into transitioning into winter, I am always concerned with making sure that kids have warm coats, that they have shoes that are appropriate, that they have hats. I like to see kind of neighborhood collective in a safe way, some babysitting kind of stuff, or some, just kind of community neighborhood fun events where I just don't think we can ever surround kids with too many adults who care about them and who are watching out for them. And so I think whether it's looking at your local food pantry, or helping your school lunch program, or making sure that kids have warm clothes and blankets and those kinds of things, energy assistance programs for families who struggle with utility bills. I think there are a lot of ways to get involved that can just provide some of that cushion between families that are kind of on the edge and what a full crisis.
Mm-hmm.
Yeah. I'm seeing too in some of the smaller communities, there's organizations pulling together. This pandemic has been tough, but I think it's making people more aware of the needs. So we've had areas where we're seeing groups get together and form some type of assistance for those parents who might have, they have to go to work and the children are doing their online homework and need supervision. And some groups are pulling together, and I just heard about this yesterday, that the group was pulling together and offering after school or school hour resources to help supervise those kids when they needed to be doing their homework, but the parents weren't at home and they were worried about how they would be managing that. So just creative things to help keep kids in their home communities and on track, not running out and being disruptive in the communities, but having a little bit of help with supervision, because we know that those older kids can't always go to the daycare centers and they still need some structure.
It takes a village is what I'm hearing from all of you, and we have to be the village.
Yes.
Mm-hmm, definitely.
We just have about 3 minutes left, so I want to give you guys a chance if you have any closing thoughts or things you hope people take away from this. This is the end of the session, so this is your chance.
I would like to share a big idea that we're working on at DHS, since it's the Ideas Conference.
Yes.
Something that maybe surprises people is in Iowa, if you are a licensed foster parent, you get a monthly stipend in order to cover the cost of taking care of a kid, right? Like, kids aren't free. I've never met a free child. Kids are actually very expensive. In Iowa, though, as we make a big push to keep kids in foster care placed with relatives and fictive kin, if those relatives and fictive kin aren't licensed, which if you're like me, you're not licensed, but you have little ones in your family you care about, if you accept kids into your home but are unlicensed, we have no way of providing financial support to you. So that is a major gap around resourcing what we know we actually want. So the big idea we're working on at DHS, which I'm really excited about, is we're working on a strategy that would allow us to give a financial stipend to those relatives and fictive kin, even if they're not licensed. So even without that, we know about 58% of kids in foster care right now are living with relatives and fictive kin. So that's amazing, but we know we can do better. And we know that economics is sometimes a barrier to a loving, caring relative from being able to say yes, especially to sibling sets. Breaking up siblings is one of the most traumatic things that sometimes comes from child welfare. Losing a parent is awful. Losing your siblings on top of that is just wrenching, right? So we are hoping by mid-spring to have this program stood up. So that's kind of our big idea around helping make things more equitable and supporting what we know is best for kids in Iowa.
That's great. Now we just have 1 minute left, so unfortunately I don't have time to give everyone else the chance to do their final thought, but I would encourage folks to check out the Whova if you haven't. I know all of our audience members are watching on Whova. If you want to keep talking about these issues, you can send messages back and forth to some of our panelists and to each other there. And I just want to thank you guys so much for joining us. We really appreciate this, and I think this was a really great discussion.
Thank
you
you.
for the opportunity.
Thanks. Thank you.
And thank you to our audience members for tuning in. We appreciate it. That's all. Thanks, guys.
Yep.
All right, bye everybody. Thank you.